Late Night Health continues. I've been mentioning my friend Dr. Neil-Furman. We've known each other for a few years. He's based in Miami, Florida. And I keep saying Dr. Neil-Furman, D.O., and then I blanked on the word osteopathic medicine. And I think it bears some time to spend with Dr. Furman to talk about the difference between a D.O. and an M.D. And I think right now it's a very small difference, if you will. Dr. Furman, welcome to Late Night Health. Is there a difference between the two now?
There are differences. We're very similar and we're very different at the same time. All DOs are fully licensed physicians. We go through medical school the same way as MDs do. We do internships, residencies, and we can specialize.
We have a friend who is from Florida, and Dr. Geriatrics, and he is a plastic surgeon. And he may have even gone to the same school you did. I don't remember where he went, but it was just kind of interesting. In your practice, do you do a combination of alternative as well as allopathic healthcare?
Well, allopathic is more of a traditional healthcare. Medicines, surgery. Osteopathic medicine is a more holistic way of viewing medicine, viewing the body, and treating disease. It is a way of helping the body cure itself, not just throwing pills or throwing medications at people and watching and seeing what they do.
And so that's your first step. But if somebody, for example, has high blood pressure and you prescribe something like the E word, exercise. And
that's a dangerous word.
It is. And it doesn't work, then you can go to a blood pressure medication if you need to.
Of course. The first thing we always prescribe for someone with high blood pressure who just walks into the office, diet, especially a low-salt diet, exercise, weight loss, relaxation, biofeedback. Again, if they're coming to my office for the first time, they're nervous. You don't know what Dr. Furman is going to do, going to say. Where is he going to put his hands and fingers? You don't want to think about that. So your blood pressure might be up.
And I've seen his fingers, and never mind. That was a joke. You were supposed to laugh at that one.
Just so you're aware, when I do a rectal exam, I use two fingers. That way I get a second opinion.
I'm glad I'm in California because I'd have to go to Dr. Furman, and so would you, Daryl. Anyway.
My fingers aren't that long, don't worry.
Got it. Somebody goes to the doctor, especially the first time, doesn't know Dr. Furman, doesn't know that, and I checked you out, you have an extremely high bedside manner. You're a nice man, you're a caring doctor, and frankly, we need more Neil Furmans.
Well, thank you very much. Part of my practice is just relaxing the patient, talking to the patient, putting them at ease. A good joke can help a person out. Laughter, as they say, is the best medicine.
And one of the things, though, that when you walk into a doctor especially for the first time, you get that blood pressure cuff on, your blood pressure just naturally shoots up.
It does. Well, we have a rule in our office. We get the patient to come into the room. My medical assistant will come. They'll talk. They'll take a little history. They'll let you sit down for a few minutes before they even put on that blood pressure cuff. Once you're more at ease, the blood pressure obviously goes down, and it goes down pretty quickly.
Oh, that's interesting. That's interesting. We want to talk about a dermatological issue from a company called Derma, and that is psoriasis, because it's becoming more and more prevalent. What is psoriasis, first of all, and what do we know causes it?
Well, psoriasis is a skin condition. It's when the skin cells multiply multiple times faster than what they should. It usually occurs on the knees, on the elbows, can be on the scalp of the head, the chest, palms, the soles of the feet. It causes a red plaque. It covers that's covered in white scales, essentially. They can be itchy. They can be painful. They might
And
even
it's
crack
ugly.
or bleed.
It's ugly.
It's ugly. It's nothing pretty. Yeah, you just don't want it, obviously. You just don't want anything on your skin because people see it, and it's not pretty.
And today, both men and women, you go to a Macy's or a department store, they have skincare to maintain a beautiful, healthy, alive look. We got to go afterwards today, Daryl. You and I both, together to the skincare counter. But
How
as
many
long
hours
as-
do you guys have?
It's not as long as it's not manis and petties, I'll be okay.
Oh, okay. I guess what I'm saying is that we want to look the best we can, and then we get hit with psoriasis. Do we know what causes it?
It's a hereditary condition, so we don't really know exactly what causes it. We know what can make it worse. We know what can set off an attack, but there's no understanding of what actually caused it from the very beginning.
We don't know if it's a bacteria, virus, or just something genetic.
There are medications that can cause it. There are
Wow.
people who are stressed can get a psoriatic flare-up. There are infections, something like a strep infection can cause it. It's basically an immune problem. It's an immune system issue.
Is it like an autoimmune
Correct.
system? It is an autoimmune system. I know that people who have it, if they're stressed out, like they have to go to a job interview,
Yeah,
or
very much.
or visit their in-laws, they can have a flare-up.
Well, I liken psoriasis in the same way as something like IBS, irritable bowel disease. You can be great. You can be wonderful. Everything is going under control. And if you get that stressful moment, a traumatic issue, and you're going to have a flare. If you have IBS, that irritable bowel syndrome, you're going to be running to the bathroom. For psoriasis, you're going to get a flare-up, and you're going to get this rash. You're going to get these lesions, and it's not going to look pretty.
I know that IBS can run in ethnic communities. What about psoriasis?
Psoriasis, anyone can really get it. It's not really limited to one or two different groups.
And so it just across the board.
Yes, sir.
One of the things that can food cause that as well?
A lot of causes of flares. Alcohol can be one. I talked about some medications. Ibuprofen has been known to cause flare-ups. Gout medicine, something called indomethacin. Your listeners might be aware of something called beta blockers, which is a blood pressure medication. Another blood pressure medication class, something called ACE inhibitors, can also cause flare-ups. Smoking also can lead to flare-ups as well.
Once again, another strike against smoking. In that case, can you, if you stop smoking, for example, or will your psoriasis reduce or go away?
It will. I'll say it will get better. I can't promise you that it will go away completely, but the flare-ups hopefully will be less.
You've discovered a product, and we don't normally talk about products, but you found one that that works really well. It's called Derma Zinc.
Correct. We found this product. It works very nicely. It helps reduce the flare-ups. We have different types of products that are used between shampoos, between creams, that not only can help with the actual flare-ups, but can also help prevent the flare-ups as well.
And how does, I don't even know if you know this one, but how does Derma Zinc work compared to other over-the-counter psoriasis treatments?
The way that Derma Zinc works is the way that a lot of other medications work. It keeps things moist. It keeps the skin from creating these plaques, from creating these scales. Not only do we have a over-the-counter version, there is a prescription version that can be compounded that adds in a steroid that even makes it that much stronger.
Oh, my goodness. Now, steroids are something that we don't want to be on for an extended period of time, though.
Correct. But these are relatively low-potency steroids. They're also topical steroids. The major problems that we have is when we take these oral steroids, when we take the injectable steroids. They're much stronger, they're much more potent, and they have a lot more side effects. The topical steroids aren't as strong. They're not absorbed by your body. So you're not going to have kidney effects. You're not going to have liver effects that over time is definitely going to be harmful.
And you're also not going to grow muscles like Arnold Schwarzenegger.
No, and you can even use this, and you'll be eligible to go into the Baseball Hall of Fame.
Oh, okay. Well, that's a good thing. Our guest is Dr. Neil Furman. We are talking about, just healthcare in general, but now specifically Derma Zinc. Is there zinc in this particular product?
There is some zinc in there, yes, but that's not the
active ingredient
product. Correct.
Because I'm thinking of sunscreens where they put that white stuff on your nose. It's like
zinc oxide.
Zinc oxide to prevent sunburn.
Well, the honest answer is that Derma Zinc works best on psoriasis, but it's also effective on different skin conditions as well. We use it for rosacea. We've been using it for eczema and seborrheic dermatitis.
Oh, wow.
And we've gotten very good results with it.
And better than injections, safer than injections and prescription products?
I prefer over-the-counter, safer materials, safer medications than prescription medication any day of the week. There are much fewer side effects, much more. It's easier to use rather than using an injectable medication. Injectable medications, as I said earlier, with the side effects of liver problems, kidney problems, you're just asking for problems, more side effects with these stronger medications.
When we come back, I'd like to talk about some of the topical treatments and the fact that you can actually get a prescription strength Derma Zinc by going to a compounding pharmacy. We'll find out what that means in just a couple of moments. Our guest, Dr. Neil Furman from Miami, Florida, home of Wolfies. I don't think it's even there anymore.
Not anymore.
Not anymore. What a shame. But Joe Stone Crabs. So
Still there.
All right. Dr. Furman and I will be back in just a couple of moments. By the way, you can get us now on iTunes. Go to iTunes, search for Late Night Health, download, listen, and of course share. Late Night Health continues. Don't go away. More coming up.